Deborah Swain, please introduce our speaker today.
Yes, I'm Deborah Swain. I've retired from North Carolina Central's Health Informatics and Library School, but keep in touch with the DCHI seminars. They're wonderful. Dr. Stroud spoke a few years ago, and I was just hoping we could get her again. She is the executive director of the One Health Commission, and they are promoting worldwide research and collaboration on human and animal health care. She received her BS and her DVM at Mississippi State and her PhD in endocrine physiology at NC State in 1990. She spent 8 years in basic research at Penn State. And while in private vet practice, she especially enjoyed internal medicine and educating clients about zoonotic diseases. In 2010, she helped create the North Carolina One Health Collaborative, NCOHC, and over 3 years chaired its steering committee. Now she shares the One Health concept and updates around the globe. She received in 2013 a U.S. National Biodefense Science Board option to serve with them. And I just can't say enough about One Health and encourage you to check on it online and to contribute. As adjunct assistant professor, just to sum up, Dr. Stroud in the Department of Clinical Sciences in North Carolina State and the College of Vet Medicine. She speaks to groups worldwide and supervises interdisciplinary graduate courses at NC State for vet, public health care, health informatics, and medical graduate students. So look into it for a course. It was established in the RTP area to bring key veterinary, human, public, and environmental health stakeholders together. We're lucky to be in RTP and to have this combination. And here we are with PhDs and MDs and government officials from Duke, UNC, Chapel Hill, and State. So the One Health Commission promotes One Health philosophy for practical integration of human, animal, and environmental health. I'll let Dr. Stroud speak and tell you more. Thank you and welcome, Dr. Stroud.
Thank you very much, Deborah. I'm very glad to be back with this group. I think you folks who deal with information, the librarians and all the other sectors that you represent are incredibly important and we really appreciate your participation in the One Health space. I'm going to turn my video off just so there's not a little talking head at the top corner of every one of my slides, but then I'll turn it back on later if that's okay. And is it going to let me turn it off? There it goes. So what I'd like to do first, right out the gate, is just to kind of get everybody oriented about One Health here locally. So historically, back in 2003, there were a group of faculty and state agency public health officials who started and ran a One Medicine Symposium. David, you may remember that. And it ran from 2003 to 2015 and then stopped due to lack of funding. But that was a springboard literally for me, because I discovered that when I moved back here in 2008. And in 2010, a group of us started that North Carolina One Health Collaborative that Deb was mentioning. And one of the things that collaborative did, it was born out of the Intellectual Exchange Group program at the North Carolina Biotechnology Center. And one of the things it did was to create that interinstitutional One Health course that is cross-listed across Duke, UNC, and NC State. That was started in 2011. I left leading that. I led the course for several years and then left it to go become executive director of the One Health Commission. That course has continued for 13 years and to my knowledge continues today. So that just gives you a little bit of the lay of the land for some of the One Health things going on here in North Carolina. So I bring you greetings from the One Health Commission, which is a nonprofit that is chartered in Washington, D.C. back in 2009, and really focuses strategic priority-wise to connect all the One Health stakeholders, creating teams and networks that work together across disciplines to educate about One Health and One Health issues. So I've been eating, sleeping, living, and breathing One Health since about 2010. And I just always try to real quick say thank you to the organizations that have supported the One Health Commission financially through the years. What I'm going to try to do, and I do have a lot of slides, and I apologize, I do go kind of fast. I will, as you guys know, I'll provide this slide set as a PDF because there are links on some of the slides that some of you might find, you want to go learn a little bit more than I had time to say. So, just a real quick what One Health is all about. Make sure we all understand the full scope of One Health, share some stories, give you a real quick glimpse of the 70,000-foot global perspective and why it matters to you. I see this slide that was used for the vector control professionals got left in here. So, why it matters to information professionals. So, sorry about that. And my take-home messages, I have two main take-home messages for you guys. Number one, no one profession can know everything. And we probably all agree that we need this One Health conversation, but the collaborations that we need are not just magically going to happen in our current systems. We're going to have to step out of our comfort zones and actually create opportunities to form the relationships that we need for those cross-disciplinary and cross-professional collaborations. So that's the first message. Our systems are going to make us have to actively pursue this. And the second message for One Health is that it's going to require both top-down and bottom-up actions to be fully implemented and fully realized. And so just kind of bear that in mind as we go. By that I mean top-down, I mean from support from government and from agencies and funding stream decision makers. That's the top-down piece. The bottom-up piece is the grassroots, the people, the boots on the ground and the public health departments and organizations that really support and try to help make this happen. So, two take-home messages. I hope that you'll just kind of bear them in mind. So, there are so many definitions for One Health out there. I'm sure you've seen them. It's really a concept, it's an approach, it's a way of thinking. To me, it's a matter of truth. It's a way of behaving and decision making that is based on the recognition, awareness, and actions, decision making based on this awareness of the inextricable interconnectivity between us, the humans, the animals, and the environment. And so this is just a handful of logos from groups all over the world that have been working on this for quite a while, and we'll mention how it's become a global movement, really. We'll mention later also this definition that was created by the United Nations One Health Quadripartite, which is made up of WHO, FAO, WOA, which is the World Organization for Animal Health. You may remember when it was called OIE. And also recently added is the United Nations Environment Program. And what I've highlighted on this slide for you are the really critical pieces for One Health: collaboration, communication, coordination, and capacity building. So just bear those in mind because those are the crux of One Health and how we find ways to do that across disciplines and make sure that everybody needed is at the table when we're dealing with any particular challenge, because we're not always there. And it's not a new concept. It's a very old concept. Hippocrates back in 400 BCE was talking about airs, waters, and places. Rudolf Virchow, you guys may be familiar with, considered the father of pathology. He was a pretty impressive gentleman. He was both a medical doctor and an animal doctor, and he was the one that made the famous quote about between human and animal medicine, there are no dividing lines, nor should there be. And also just recently learned that he was also critically involved in the creation of the field of anthropology, which is fascinating to me, this really man of many talents. And William Osler, there are just so many people. So it's not a new concept. It's an ancient concept that we're trying to resurrect this ancient wisdom. It's not a new concept, but it is a new professional imperative because of our systems. So it's our systems that have forced us into these silos. Things like academic tenure processes, our government agencies are in silos. We're really working hard on that. I hope we'll get to talk about it quickly. Industry research is proprietary. Corporations don't want to share their research data because they're working on something special that's going to make money to pay for the research. the publication systems is the one that drives me most crazy because most research is done on tax dollars, public tax dollars. Um, but for many, many, many years, it always got published in professional association journals where um, only if you were a member of that journal could you have ready access to that research data. Open access is helping us some with that now. We just have to be really, really careful about keeping the quality and the peer review process up, so keeping the quality of the research up. And then we have silly things like language barriers across professions that, especially for those of us older and longer established in our professions, we're a little intimidated to go talk to somebody in another discipline who might use an acronym that we don't understand. And we'd be embarrassed and look stupid if we had to say, I'm sorry, what are you talking about? So there are a lot of silly things there that play into this, but it's our systems that have forced us into these silos, as our education systems push public health into one stream and veterinary medicine into one stream and human medicine into one stream and medicine into one stream. So that's why we need this resurrection of this way of thinking. And also underlying the One Health movement is a whole leaning toward our recognition of our human impact on the environment, and that how the environment, we have this huge, huge capacity to damage our environment. And frequently as humans, we don't really realize. I mean, we often think that we're the center of the universe and everything revolves around humans. Everything's about human health, not really remembering that we're just part of an ecological continuum. We're just one of the animals, and we really, really need to remember that. So there's that underlying theme also in One Health, and a lot of people for a number of years now, since planetary health was born as a profession, people get confused and think they're the same. And I will tell you that we are pulling on the same rope in the same direction, but planetary health is really focused on the human environment intersection, and One Health is really focused across the human, animal, and environment and plant intersections. So we're not quite the same. We do definitely try to support each other. What the planetary health movement is doing is incredibly important. We really need to be paying attention to that intersection. But it's not quite the same as One Health. So I'll just opine that for you there. And we need to also be aware of the ecosystem services that nature provides us. So a lot of reasons to keep the environmental component active in our discussions. This One Health conversation that we're in right now, this current, what we call One Health now, in my mind, really emerged as a conversation in the late 90s, coming out of the conservation medicine and biodiversity sectors. And they were pointing out, oh my gosh, look at all these diseases that people get that come from animals. And so that kind of started it. And then if you remember back in the early 2000s when avian influenza was a scare, and then of course HIV/AIDS, a lot of people still don't realize that HIV/AIDS was a zoonotic disease. That's how it started. And so all these zoonotic diseases were definitely driving forces for this One Health conversation. They kind of really got it going. And we definitely had a lesson in that. And starting in 2020 with the COVID pandemic, it was really embarrassing to be the reddest continent on the planet, if you were following the Hopkins maps. So that was quite a humbling experience, and we could talk for weeks about it, I'm sure. And right now we're living another challenge that's very frightening, and many of us have been holding our breath, just hoping that the avian influenza virus doesn't make the tiny mutation that it would require to readily jump from person to person, or we could be in this similar situation. And if you are familiar and been tracking, you watch how avian influenza has jumped to so many mammals. And you can track how it's being tracked in mammals on the USDA webpage, and how the cases are being tracked in humans on the CDC webpage. But there are still a lot of questions. We still don't have enough. I don't think we have enough surveillance and research going on. We still don't know exactly what's happening in the cows or what's happening in the farm workers. That's been the biggest challenge, I think, for avian influenza that we're in right now. A lot of farmers really don't want us, the scientists, to come on their farm and find out who might have avian influenza. So there are a lot of challenges on that front. But this is one of the One Health kind of things that we're dealing with right now, along with some of you may not be aware of the screwworm, the New World screwworms that seem to be trying to cross the borders coming in from Mexico. So USDA actually last month, USDA, CDC, and DOI ran a collaborative exercise about just how they are going to deal with New World screwworm if it shows up in this country, and it's really, really gross. I mean, this thing can burrow into the skin and really wreak havoc on domestic animals and people. I think the nastiest story I heard was one of these flies must have laid an egg in some lady's nose and down in one of the South American countries, and she didn't know it, and she got one of these screwworm things going in her nose. It just sounds horrible. So these are really, really right at the intersection of the environment, which is changing and allowing these flies and mosquitoes and ticks to expand their territories, and public health and human health and animal health, especially in the screwworm. It's going to affect us all. So just things to be aware of. So I like to think of this One Health conversation as a ray of hope for the future. I don't think we can manage if we continue on our siloed path. We've got to continue to join hands across our disciplines and professions. And over the past 20 years, we've realized that this way of thinking is that so many of our challenges today are begging for this way of thinking, for this One Health way of thinking and decision making. So I'm going to just really quickly touch on some of these. We're going to skip a stone across the water here, and it is going to be quick, but I want you to kind of get a feel for the full scope of One Health. And certainly this slide does not list all the arenas that are begging for this One Health approach. Almost any of our challenging problems today would really benefit from bringing all the health, and not just the health, but all the disciplines and professions together. So just bear that in mind. So we're just going to touch on a few of these really quickly. We're going to start out with the animals as sentinels concept. Some of you might recall the 1980s, we introduced polybrominated diphenyl ethers into the environment, and it was being put in all the upholsteries and carpets and curtains and computers, towers back in the day. And back then in the late 80s, we started diagnosing hyperthyroid cats. So we had never been diagnosing hyperthyroid cats before that, and some really brilliant people over at NIEHS said, I wonder if there's an association. And indeed, there was a very high association of when the PBDEs were introduced into the environment and when we started diagnosing hyperthyroid cats. And it turns out those PBDEs are very potent endocrine disruptors. And we had been putting them in children's pajamas, and some questions are being asked now because it was really affecting the hormonal maturation of children. So a similar study, a similar story emerged for perfluoroalkyl substances, the PFAS, the forever chemicals that you're hearing a lot about these days. Again, it was a cat. It was some cats that people observed that kind of tipped us off on those also being endocrine disruptors, along with the other many problems that they can cause. So the point here is that if we're paying attention, we can see what's happening to the animals and realize that it's probably happening to the people too, because we live in a shared environment. We experience everything the same. And some of you may know the story of how West Nile came into this country. I'll really, really quickly share with you. Tracy McNamara was a veterinary pathologist at the Bronx Zoo in 1999. And when she started finding dead crows around the zoo, she would do autopsies, or necropsies as we call it in veterinary medicine, and found a horrible encephalitis. And it was about that time that New York was also experiencing people dying of a horrible encephalitis. And Tracy started wondering, I guess the thing that really triggered her was that CDC thought this was a Western equine encephalitis. And she knew that the flamingos in the zoo should be extremely sensitive to Western encephalitis, WEE, and they weren't dying. So she wondered what was going on and finally got some samples tested. And it turned out it was West Nile, and the story evolved from there. And she makes a really good point in this little YouTube video. I think you guys would, if you haven't seen it, you would find it fascinating. that our funding streams are the opposite of One Health. We put all our medicine looking at human health. We don't put a whole lot, all our medicine, all our money looking at human health and not so much on ag or wildlife or everything else. So there's really a really poignant point to point out is that we don't have a CDC for animals, and we really do not have a system for biosurveillance for what might be emerging out of animals in this country. So Tracy's been working now for like 30 years trying to change that. Although, as you know, these things are very difficult. A similar thing happened in 2017 to a shelter. And again, it was in New York. It was a feline, a cat shelter. They broke with an influenza and it was obviously zoonotic. It jumped to the veterinarian and the staff. And it took like 3.5 or 4 weeks before they figured out what kind of influenza it was and what it was that the cats had. By that time, over 300 cats had been adopted out into the community. And I guess the take-home point here is what if that had been an influenza like the 1918 influenza? We could have very easily ended up with another 1918 type flu pandemic, which killed, they think, between 50 and 100 million people. So one of the points Tracy makes in her YouTube is that the way we currently operate is we really won't know if something's emerging out of animals until we have dead bodies in the morgue, basically. In other words, we're letting people, taxpayers, as she likes to put it, be the canaries in the coal mine. So we have a lot of things we really need to think about and figure out how we're going to address them, like maybe figuring out a way to see what might be emerging out of wildlife or domestic animals. Antimicrobial resistance is a quintessential One Health issue. We share our environment and we share our microbiomes with those we live with, including our pets. We know that antibiotics are in our environment. We actually introduce them in some situations, and I don't begrudge the citrus farmers for using it or the antifungals. I just hope that we're paying attention to the environment, to what impact that is having on the environment and on the soil and the plant health, the soil health and the plant health. And then I'm just going to mention this real quickly because I find it fascinating. Back in the 1940s, before antibiotics really hit the scene, there was a lot of research going on around phages. Now, some of you may realize and understand that phages are the viruses of bacteria. And so that research is resurging now. That's really exciting because that could be very targeted therapy instead of throwing an antibiotic. It's something that kills everything in its wake. You could go have a very targeted therapy. So I included here a link to this really fascinating YouTube video, a true story about how this gentleman got extremely sick unto death by an antimicrobial resistant pathogen. And they couldn't find anything to touch it. And finally, his wife, who happened to be a microbiologist, found a team that isolated a phage that could go after the pathogen he was dealing with, and it saved his life. So phage therapy, I think, is going to be really something for us to really understand and keep an eye on. One of the things under the One Health purview that are in the One Health discussion that you would not hear over in the planetary health discussion is comparative medicine, translational research, comparative biology. A lot of people don't realize that animals and people get many of the exact same cancers. A lot of people don't realize that the discoveries of how bacteria inject DNA into host animal cells were actually based on studies in plant systems. And there are actually organizations emerging to help us understand some of these cancers that we share with animals, if we could research them. And then animals that have naturally occurring things like glioblastoma, that it would help both the animals and the people for us to be able to do that research. So fascinating area. Some of you may remember some of the comparative type studies that have gone, the most recent one in 2022, when the gentleman received genetically modified pig hearts. So that kind of work has to require multidisciplinary, multi-professional teams, and that's really the forte of this One Health conversation. And I include this slide just to let you know, if you're not aware, there's a wonderful little book out there titled Zubiquity. It's written by Barbara Natterson Horwitz and her science writer companion, Catherine Bowers. It's a fascinating read on how many things we treat similarly across human medicine and animal medicine. So that's kind of a discussion between the animal health and human health world. In fact, she calls it her love letters to veterinarians. So I urge you to read that. There actually is ubiquity conferences held now that bring veterinarians and physicians together, usually in a location where they can spend some time at a zoo and also at a human health hospital. So really interesting way to make those connections. Disaster preparedness and relief, another area that is begging for us to really approach it in a One Health way, on both ends, preparedness and relief. We had a huge lesson when Katrina hit in 2005 because it's estimated up to 300 people died because they would not leave their rooftops when the rescuers came around in the boats because the rescuers were not prepared or authorized to take the animals and the people would not leave their pets. And that's really very sad. So it's very exciting to see that we're starting now to have that One Health way of thinking on the preparedness on the front end of a disaster. When I was out on speaking in Harris County, Texas, right after Hurricane Harvey, I guess it was, hit, Harris County Public Health was all about One Health, and they had this way of thinking in mind and were prepared. They had a plan in place for what was going to happen to the animals. So that was so refreshing and exciting to see because we need to be thinking about this on so many fronts, not just for floods or hurricanes, but some of the horrible fires that happened out in California. And of course, we might need to rethink where we're going to put intensive agriculture situations. Putting them in places that can flood just can cause horrendous public health challenges for us. So we need to be prepared on the front end and the back end. In fact, it has been said, I love this quote, during a health crisis is a really bad time to be exchanging business cards with someone that you really need to work closely with. It was Larry Madoff, I think, that first said that, who was involved for years with ProMed. So I'm just mentioning here one little book. It's been published twice. It's a really interesting read. Who's in Charge? It's by my colleague Laura Kahn. She actually looked at the several metropolitan areas that had some pretty major health crises and evaluated whether they had relationships in place ahead of time or not, and was able to really make a strong case for this One Health way of thinking ahead of time before a crisis hits. So just something to mention. Skipping the stone again, another area that you would never hear the planetary health folks talking about, but that's incredibly important in the One Health discussion is the human-animal bond. I don't know if you got, I love the antidepressant one with the puppies and the child, what a tolerant kitty cat. I don't know if you can see this bottom center slide where it says warning tick-infested area. If you think about it, if your cat or dog goes running around in that tall grass and then comes and gets in bed with you, any ticks or fleas or vectors of any sort that they pick up in those grasses, then you're being exposed to them all. So, and it just is a reiteration that we live in a shared environment. So just another way to keep thinking about the environment. And there are social environments as well as physical environments. So the human animal bond is also a strong part of a kind of a negative thing that an organization called the National Link Coalition has been trying for years to shine a light on the connection, the link between violence to animals and violence to people. It's just a fascinating work that they've done, training people all over the world and helping shelters understand that victims of domestic violence often will not leave their abusive situation if their abuser has threatened to hurt their pets. And they often won't leave because they know that the shelters won't take their pets. So this organization has been able to influence shelters to a great extent to make arrangements or to either take the pets or make arrangements for pets so that people will get out of their abusive situations. So that's part of the human animal bond, and it applies also to large animals, to agricultural animals. So I'm going to have to talk fast here, so I'm going to probably not get to say as many things as I'd like about each point. I love to teach One Health and relate One Health with true stories. Here's one that's set down in the Caribbean in Trinidad. And it was a really rainy summer, and these young people, this young boy was out playing in the floodwaters with friends, and he got really sick. So he went to the doctor, and the doctor thought he had dengue and said, just go home and rest. And he did, and he didn't get better. And he went to the doctor again. They thought he had dengue, said, told him to go home and rest. So he did. And a few days later, he was dead. Now, it's not surprising in a situation like that that they might quickly think it was dengue, but it turned out that this young man lived in a kind of a very poor community, and that they had a problem with refuse, with garbage around the place. And during the flood, the rats had emerged, and it turns out that this young man died. I'm sorry, I can't ask for a show of hands what you think it might be, but he died of leptospirosis. That would have been really easy to treat with a course of doxycycline, but the right questions were not asked because the doctor wasn't thinking in this One Health way. And this happens a lot, unfortunately. So if he had been thinking in a One Health way, even if he had read Aristotle, he would have realized that he needed to ask the right questions about the environment and where, what had been going on in this young man's life before he got sick. So these are really poignant teaching stories, and I would love to have time to go into them. In fact, guys, any of these things that I've got listed on this slide, we could probably spend a whole course talking about. So I'm just really skimming the stone across the surface here. On the food safety and food security front, we know that our pollinators are in trouble, and it's having an impact on our food systems. There are actually programs now where farmers can rent beehives to pollinate their crops. My own husband used to grow a really prolific garden here in Chatham County. And for the last few years, he could get his squash plants to just bloom and bloom and bloom, but they would not fruit. And we determined that it was a lack of pollinators. So this is happening everywhere, and we really need to be thinking systemically, systems wide about what we need to do or not do if it has to do with pesticides in the environment. And I've mentioned another little book here. I'd love to drop these little golden tidbits in here. This Restoring Eden was written by a colleague, a One Health oriented colleague who was at EPA for many years. And this is a personal story of what happened on her own property when some flooding happened with pesticides that destroyed her environment. It's taken last time I talked to her, it was like 7 or 8 years after that event, and she was just starting to get a few insects back. So really interesting. And then this is one about kind of at the edge of all, and this is where so many of the One Health interconnections are interconnected. So this one drives me crazy because I don't know if you've been following chronic wasting disease. It's really gotten more prominent across the US, and it's happened a lot more quickly than a lot of researchers thought it should, and they've not really been able to determine how this chronic wasting that's affecting elk and deer and other wild cloven hoof animals, how it was being transmitted among the animals. And I guess one of the things that's driving me most crazy is this is a prion disease. So it's kind of like Creutzfeldt-Jacobs. And we won't know for years if it's truly a zoonotic situation, but the potential is there. So they're paying attention now, trying to alert hunters to have their deer, the lymph nodes of their deer that they kill, because I grew up on venison. I love venison, and a lot of people feed their families on venison. But if you look down here in Mississippi, you see this little cluster right here where they have found chronic wasting. That's where my brother, who still lives in Mississippi, hunts and feeds venison to his grandchildren. And it's a mindset that I keep telling him, I know that they've got test stations set up that he could go and have the deer tested to make sure it was safe to feed his grandchildren. But I'm not sure until maybe recently I started helping him understand It's just just you've been hunting and eating deer all your life. All of a sudden to have somebody tell you there's something to worry about is kind of hard to wrap your brain around. But they're beginning to wonder if the grasses might be one of the mechanisms of transmission for this prion. And I've highlighted this section here because the researchers say it's the research for plants taking up prions is still new, and it's technically challenging because it involves mixing a number of different fields together. You need experts in plant physiology, animal rearing, and general prion work, and it's somewhat rare to be able to find that. Well, guess what, guys? That's what this One Health conversation is trying to help us do. So this is just another example in my mind of how important it is for us to find ways to do that. Here's another quick One Health story. This young man right here in the red to the left, it's my little guy about 38 years ago. So this is a story that I personally lived. My little guy got a horrible diarrhea when he was about 20 months old, and it lasted for weeks, and it was highly contagious. My husband and I both got it. We were so dreadfully ill, we couldn't lift our heads off the pillow. And that's really tough if you've got a child with diarrhea and you and your husband are both sick with diarrhea. So we kept taking him to the pediatrician. The pediatrician saying, "Oh, it's just a virus. He'll get over it." Well, 6 weeks into it, he wasn't getting over it. And my husband, we were both at the vet school here at NC State, and my husband was on faculty. He finally took a diaper into the parasitologist, and I wish I was in the room so I could ask for a show of hands, because I doubt many of you remember if I talked about this 6 years ago, but it turned out to be Cryptosporidia. Now, when I called the doctor's office, the pediatrician's office, this was in the 80s, guys, so it might be quite a bit different now. But when I called the pediatrician's office and told them what we had found, they acted like they'd never heard of it. So now HIV/AIDS has really put crypto on the map. It was killing a lot of people, immunosuppressed people. And the scary thing about this story is that if there had been an immunosuppressed person in our household, it could have been devastating. And I'm hoping that today we're starting to find ways to share that kind of information across our health professions because it's so incredibly needed for so many reasons. It can save lives. So, another real quick story. This one is a story about a veterinarian's daughter who was a travel writer, and she went down to South America and had a fabulous time climbing a volcano and going way up the Amazon. And she got back, and a couple of weeks later, she was really sick with painful joints and fever and weird skin lesions and discolored fingernails and shortness of breath. And they found some lung lesions, and the most concerning thing was some granulomatous visceral lesions, and they just couldn't put it all together with her travel history. And her dad was at a veterinary conference and was talking to some colleagues and telling them what was going on with his daughter. And one of them said, "Well, she probably has a parasite. She needs to take some ivermectin." And another one said, "Oh, she probably has a vector-borne disease. She needs to take some doxycycline." Well, somehow somebody talked her dad into getting the doctors to send some blood samples to Dr. Brightsword out at NC State and his intracellular pathogens research lab. And they did. But in the meantime, because and this was like 2 years this went on, guys, 76 specialists and 10 CT scans later, they still didn't know exactly what was going on with her. If you could think about the mental anguish this poor young woman was going through. And so she was scheduled for an exploratory surgery to make sure that she didn't really have gastrointestinal stromal tumors, because that could be really bad. And they also had talked her doctor into sending these samples to Brightsword, and the samples had come back just about the time she was scheduled to go to surgery. And so the surgeon comes, oh, I guess I have to go ahead and tell you because I got this slide out of order. So they did find Bartonella vinsonii, Dr. Brightsword's lab did. And about that time, she was scheduled for surgery, and the surgeon comes out and says, "I didn't see any signs of cancer." And her dad says, "I don't think she has cancer. I think she has Bartonella." And the surgeon looks at him and says, "I'm a surgeon. I don't know what Bartonella is." Now, guys, this is not bad on the surgeon. This is bad on our systems because we need better ways to exchange information across professions. What if the radiologist and the who had been reading her films and her CT scans had known her travel history and had put together the fact that these kinds of lesions could be caused by a vector-borne disease that she might have been exposed to? So it's just another teaching story to me. And this Bartonellosis, we'll pause on it just for a moment here. because it's an emerging, the significance of this pathogen in humans is just emerging over the past 20 or so years. And this partnership between Brightsword and Mosiani was really an early learning moment for me because Mosiani was a rheumatologist, an MD rheumatologist, who discovered, literally ran across in the literature, Brightsword's work on Bartonella, and they teamed up and did a study over a couple of years, yeah, with Mosiani sending samples to Brightsworth's lab. And when they paused to see what they had, it was 296 patients. 62% of them had Bartonella, Henselae, cholerae, and Vinsonii antibodies. 41% of them, they actually found bacteremia. That's by PCR, finding the DNA of the bacteria active in the blood. So that's just a fabulous partnership of how the knowledge could be shared. And I just hope that we can find lots more ways to do that. So that is a vector-borne disease, and we know it affects people and animals. And I don't know if any of you are familiar with the Companion Animal Parasite Council, but that organization has been tracking the Lyme antibody discoveries in dogs. So there's a little SNAP 40X test that your veterinarian is very likely using because it's so commonly used. When you test your dog for heartworms, it tests for heartworms, anaplasmosis, Ehrlichia, and Lyme disease. Now, it's not testing for active disease, it's testing for antibodies. So if you can overlay the map, if you look at this area right through here and here, you can overlay the map that the Companion Animal Parasite Council was able to determine from that data coming from veterinarians looking at dogs, with the map that CDC was plotting at the time for Lyme disease. Now, I know Lyme disease can be a bit controversial, but the point is that the animals could be a sentinel for us, so they could actually be excellent research models for us. And my major question is, are we letting humans, again, be the sentinels to help the human health community be aware that Lyme disease is something that really needs to be on their radar when they're dealing with sick patients. So again, we might be letting humans be the canaries in the coal mine. So just another teaching story. One of the most amazing things to me that's come out of that research is the occupational health risk of animal health workers and veterinarians. So this red dot you see to the lower right here, that's actually Bartonella being lit up in the bone matrix of the femoral head of this veterinarian that had to have a hip replacement because of degenerative arthritis with no family history. So it's a fascinating, and we've not been testing for it in the past for blood donations, and we know it can cause some pretty major issues across many systems, ranging from neurologic to eyes to GI tract. So it can present a lot of ways. It's just a pathogen I really try to raise awareness of. So veterinarians and other animal and agriculture workers who spend a lot of time outdoors and with animals are at an occupational risk for a lot of vector-borne diseases. And those occupational risk discussions need to be happening at the intersection of our professions. And of course, some of you will know Kay Hagan's story. This is such a heartbreaking story to me. Kay Hagan was a senator for us here in the state and then at the federal level. And she died of Powassan virus, which she thinks she got from hiking, from a tick from hiking. And the wonderful thing about Kay's story, which is, I remember being devastated when I learned that she had died, but the wonderful thing that happened is very, very quickly, there were a group of people who came together to put together it. So she died in 2016, and a group of lawmakers put together the 21st Century Cures Act, and that funded some Centers for Excellence for Vector-Borne Diseases. And then the Kay Hagan Act got passed in 2019. And all of that eventually led to the creation of this national public health strategy to prevent and control vector-borne diseases. And this report has One Health woven all through it. So this way of thinking is making it into some of our top-down situations. It's just we need a lot more of them. And I'm always so sad that had to happen to Kay Hagan. So we're seeing a lot more One Health success stories. This is a real quick one from Kentucky that I learned about years ago. The public health officials there in Kentucky had noticed that there was a seasonal spike, that they were being reported from their animal health colleagues that there was a seasonal spike each year for EEE, which is Eastern equine encephalitis, and that they wondered why, so they actually spoke to an entomologist at the University of Kentucky, and who said, "Oh yeah, that's easy. That's because the Corps of Engineers controls the water levels on their local reservoir, and when it hits a certain level, we see a spike in, they call it a bloom. We see a mosquito bloom, and that's where both the animals and the people were at risk. So, duh, the public health guys were able to broker a conversation between the entomologist and the observation of this." Mosquito bloom when the water levels hit a certain level, and the health, public health, and animal health risk for EEE, and that conversation led to the Corps of Engineers making an agreement that they would share information forecasting when the water levels were going to hit that magic point, and so that public health measures could be taken for mosquito control. And so it's like something you would have thought would have been in place for years, but it wasn't. So that kind of conversation, and guys, the point here is that that can emerge from the grassroots. That information and awareness can emerge from the grassroots. It doesn't need some high academic person or government agency person to figure it out. We all need to be aware, and we need to be thinking this way. And the economic benefits are profound. There have been so many publications about the economic benefits of One Health. And it was really estimated that the COVID pandemic was going to cost us around 82 trillion. I don't know what the number has ended up with because we're not quite done with it, but having been able to prevent something like the COVID pandemic would have saved enormous amounts of money, not to mention the lives. And it's really sad to me that sometimes it takes not just the loss of life to get action to happen, it takes the loss of money, which is a sad state of our cultures. So what can we do about all this? Most of us would agree we need to do this, but how do we go about it? And it's a lot easier said than done. So there have been some major giants in this space. We're all standing on the shoulders of people like Jim Steele, who was the first veterinarian at CDC and help CDC, the human health thinking people, as they should be, think about, okay, well, what about the animal interactions here, and how could they play a role? And Calvin Schwabe out at UC Davis, who was actually thought to coin the term One Medicine, which is what this whole movement was referred to before it became called One Health. So these are some giants that we're standing on the shoulders of. In 2004, there was a group of thinkers. I like the way this put. A group of thinkers met and actually came up with this 12 Manhattan Principles that basically launched this concept that is now called One Health, and helped us start really talking about it. And as I mentioned, it's now a global movement. So this is one of the maps that the One Health Commission puts together, showing all over the world the different places that are actively working and embracing One Health. And we had so many of them, we had to break them into academic institutions, government agencies, nonprofit organizations, private, for-profit. So you can find that on the Commission's website under resources, under the Who's Who maps. And there have been World One Health Congresses going on now since 2011. I've been able to go to a number of them. The next one's in Lisbon, Portugal this year. I hope to get to go. And there are many countries, you see the countries colored in green here, that have formally adopted at government level national One Health strategic action plans. You'll notice the map on the right, and the yellow countries, those are the countries that have adopted formal One Health antimicrobial resistance plans. So it's been fascinating to watch this. And by the way, guys, we are about to color the United States green. For many years, it has been distressing to me that nothing in the Western Hemisphere was colored green, indicating that a country had adopted a national One Health strategic action plan. So that's about to happen for the United States because of this U.S. One Health framework that has been developed and released. It hasn't really gotten too far. I understand that a One Health coordinating unit with representatives from all the agencies are meeting and discussing challenges that are addressed across the agencies. And so that is actually getting started, and we're going to be coloring the U.S. green. Brazil is another country that's very close to doing that. We'll be hopefully coloring Brazil green. So two countries in the Western Hemisphere may get to be represented on that map. In 2016, we launched a One Health Day that is celebrated all around the world. It doesn't have to be right on that day. It can be any One Health event all through the year. So it's been really fun to watch that. Even during the pandemic, guys, people were finding ways to celebrate and teach about One Health. So that's really an opportunity for local communities and organizations to go into their community and teach about One Health and One Health issues. It's been very well received and picked up around the world. We also lead a One Health Awareness Month. It's a wonderful story how that launched. I'm not going to have time to share it with you now, but go and look at this webpage. And this is a social media campaign trying to find ways to raise awareness about just what is this One Health thing that we've been talking about and what can we do about it. And those Manhattan principles that I shared with you, they were kind of updated and expanded upon in 2021 with what's referred to as the Berlin One Health principles. And I would be remiss if we start talking about organizations and activities all around the world for One Health. I would be remiss not to mention the USAID Emerging Pandemic Threats Program that framed everything in One Health. And it's because of that that we now have a One Health, an Africa One Health University Network, which is these are the countries where those exist, and also a Southeast Asia One Health University Network. And it's just all because that Emerging Pandemic Threats Program framed everything in One Health. So it's fascinating to see that, and also heartbreaking to think about the loss of USAID and programs like that. But Afrihoon and Shiahoon, the Southeast Asia University Network, continue. And I mentioned the One Health Quadripartite, jumping out to the international level for a second. They stood up in 2022 a One Health high-level expert panel that has been quite a prolific group that's advising the quadripartite in this One Health space. Just to make you aware, they were the ones that helped develop this definition that I shared with you. The quadripartite has also put together a One Health joint plan of action, which is quite an elaborate kind of theory of change for this One Health discussion. And if you read these things, you can really see where our barriers are and start to get ideas about how we can get beyond them. And in this One Health space, things can get a little confusing. There can be organizations with similar or same names. For example, in 2019, The Lancet, that you're probably quite familiar with, launched a One Health Commission. And a lot of people get confused about the One Health Commission that I lead and the Lancet One Health Commission. So we're always trying to straighten that out. And then France has been incredibly supportive at the government level. In fact, this is a recent YouTube video that Emmanuel Macron has put out for this France hosting this One Health Summit on April the 7th this year. They also launched an organization known as PREZODE, or the Presenting Zoonotic Diseases Emergence. So it's very exciting to see countries picking this up. Germany, and the GIZ is the way they say it, the German Corporation for International Cooperation, has also been leading a lot of One Health activities around the world. PAHO has its own One Health policy statement. That's very exciting to see. And in 21, we started seeing One Health being brought up at the G7 and the G10. In 2022, it was brought forward quite prominently at the G20. This Lombok G20 One Health policy brief was shared there. In 2023, India was the host country. They themed the meeting that year, One Health, One Earth, One Family, One Future. Very exciting to see that. 2024, it was hosted in Brazil, and they also put together this leaders declaration declaring that they emphasize advancing a One Health approach, recognizing the interlinkages. So that's an awareness at the international level. Canada has its Royal Society, which is kind of like our National Academies of Science, Engineering, and Medicine, has also put together a working group on One Health, and have put out some wonderful document and report on that. So I'm just going to buzz through here. I told you Brazil is going to be next up. I want you to be aware that there's a Women for One Health group, a fabulous network of women and men who are really working for equity, and not just gender equity, for a lot of cultural, socioeconomic groups, so that they can be better represented and better appreciated in this One Health conversation and space. If we zoom the lens back to the United States real quick, I'm going to have to fly here. The state of Washington, since 2014, has been emphasizing One Health. In fact, I got that state one ahead of this. I just wanted to make sure you guys are aware that the Smithsonian had put together this fabulous One Health exhibit. The full exhibit is closed now, but they have the pop-up version still on permanent display in the Smithsonian. So if you can get to DC, to the Museum of Natural History, please go and check this out. It's a really interesting and fabulous way of reaching the public with this One Health message. It's all about zoonotic diseases. So it's not the full scope of One Health, but it's incredibly powerful teaching tool. Our APHA has a One Health section now, and New Jersey has legislated at the state level a One Health task force that they have put together across the state now. California has passed a bill calling for a One Health framework. I understand it hasn't been funded, so it hasn't gone very far, but it has passed. Pennsylvania now has a Pennsylvania One Health consortium, and they're working across their state government agencies and academia and local organizations. We kind of started doing that here in North Carolina back in 2010. And then it turned into just mostly the course here in North Carolina, so it hasn't really turned into what I would consider a real strong collaborative. And many states, and this is going to hopefully happen more this year because there's a group trying to get every state to do a One Health Day declaration. So that would be really fun to watch. But since 2017, we've had states making these One Health Day declarations. I'm going to have to zip through. I just want you to be aware there's now a North America One Health University network and a Canadian One Health University network. And of course, CDC has a fabulous One Health office doing great work. And just to make you aware, they do a fabulous zoonotic and zoonoses and One Health updates telephone call that you can get on the mailing list, or you can just go and look at these presentations yourself. They're really very, very interesting, and they provide continuing education across disciplines and across professions. So that's what I meant by some of the top-down, bottom-up here. In the top-down efforts back in 2015, the One Health Commission followed Senator Al Franken's lead when he wrote a letter to the Obama administration urging for the creation of a One Health framework. So that was 2015. 16 and 18 saw bills introduced into the Senate trying to establish an interagency One Health program and for other purposes. And then in 19 and again in 21, for the first time in a bipartisan way, both Republicans and Democrats introduced One Health bills, the same One Health bills, into both the Senate and the House. So, none of that has gotten passed, but it has put One Health into the congressional record. And when I go to DC now, I don't get such a dull blank stare when I say something about One Health. So that's rather exciting. Another thing that happened, and you've probably never heard about it, but Gillibrand introduced a One Health Security Act that its major goal was to really kind of level that funding playing field across the agencies and might have been able to see us create a biosurveillance system for what might be coming out of wildlife. But it hasn't gone anywhere. It died in committee, and so that's kind of where that is. And then if you get a chance to go look at this, you can kind of see the history of how we came to have a U.S. One Health framework. And just kind of hold your breath and watch and see how things go in our current situation. And I just want to remind you that my takeaway was that no one profession or discipline knows everything. We need each other. We need each other from the environment, from human health, from animal health, from plant and horticulture and agriculture health. And truly, no one species, arena, or sector is okay until everyone is okay, because we're all so connected. And we've got to have this top-down, bottom-up approach. It can't just come from the top, and it can't just come from the bottom. We're going to have both. And if any of this resonates, please feel free to go sign on to the One Health Commission's listserv, and you can follow the global One Health movement through our One Health Happenings newsletter, because we're all about joining hands across the One Health movement so we can really, really make this happen. Thank you so much for listening. I apologize I didn't give you time for questions. I'm happy to answer any. I'm happy to stick around as long as anybody wants to. So thanks again, Deb, for bringing One Health to this conversation, and David for supporting it. I appreciate you guys.
Thank you very much. Let's take time for just a couple of questions. In the chat, Deborah Swain got kind of practical in thinking about students at her university, and I'm thinking about the ones here at UNC. How can students effectively take veterinary school or One Health courses? if they're in a completely different kind of discipline.
I'm having trouble turning my video back on for some reason. Um, so how can students get involved? There's the International Student One Health Alliance, and there are many, many student groups popping up, and students can actually drive these things at their universities. Um, excuse me. So I've known students at medical schools to go to their faculty and put together their own practicums and their own special topics where they would put together a One Health practicum. I knew a medical student that created a survey of the faculty and students at their medical school, asking them these whole questions about the interconnectedness and One Health and if they knew anything about it, and they didn't. So there are many things that students can do, and I find that students are so once they get this, they want to do something about it, and they're enthused and they're energized and they know how to make things happen with social media and all these things. So, so students can actually drive things at their universities if they're interested to. It's just all a matter of awareness and figuring out, well, what could I do? So,
Okay, so let me ask a very different kind of question, especially because this is a health informatics seminar. There are efforts among the various data standards to try to develop methods and schema so that you can connect sources of data across a variety of different kinds of systems. But for many people in health informatics, particularly looking at it from the human health perspective, they're looking at electronic health records, surveillance dashboards, decision support tools. If you could just sort of blue sky a little bit, what would be an appropriate approach to the multiplicity of potential data sources? Here I'm speaking from experience. That look at the possibilities of using data to leverage this awareness. Do you see a method, an approach that would be practical to be able to bring together enough expertise and resources to make that a meaningful programmatic response?
oh my gosh, that is a $50 trillion question. Data sharing, as you know, is a huge challenge. For many, many, many reasons. And I've even gotten myself in hot water when I bring this up in international meetings because nobody wants to talk about how you're going to actually do that. The computer systems won't talk to each other. The data sharing is an incredibly important big data and finding out ways that we can share it across the different sectors. I do not have a good answer for you, David. If you can come up with the answer to that one, you can change the world because data is a huge issue.
I can make a suggestion, and this is based on the work I did in biosurveillance, in machine learning, and the like. Artificial intelligent agents can actually do the kinds of deep dives between disciplines into data that could develop approaches and indicators that would allow us to see these kinds of issues. In my experience in biosurveillance, we took a very open approach to data, recognizing that we needed to be untraditional in our approach and to look at all kinds of data that wouldn't at first glance be necessarily applicable to, as we were trying to do, find threats to human health. And so I think part of what you're advocating in talking about this interdisciplinary approach is, I would argue, widen it even more and be able to raise the awareness of these threats to human and veterinary health among people who actually design and build these AI platforms, to be able to say, you know, a small piece of what you're doing could have significant ramifications, because while this is all based on science, everything you're talking about is based on science, it is not, it is as much an art form in trying to understand the situation as it is applying a scientific approach. There's so much creativity involved.
Absolutely. And I can see that one of the hurdles that would have to be overcome, and what you're suggesting would be the permission, even for the AI to mine the data sets. And so to get to the permission, you've got to create the relationships and the trust and the awareness and the education and the understanding. So here we are again talking about One Health. So absolutely, I totally agree with you that and I hadn't even thought about AI being able to mine the data sets. That might be one way that we could connect those, because the computer systems and the languages are so different. So that might be one way to do it, but I don't know how you get the permission and the education and the awareness.
But partly you prove the concept, and that's where graduate students can do amazing amounts of work.
Absolutely. I love
Right.
students. I adore students. I know they're going to change the world.
Okay, we are over time. This has been fascinating, and I would love to spend the rest of the evening talking with you about it, but we're supposed to end at 5 o'clock. So
Well,
I'll
I'll
just
talk
stop
as
the
long as
recording
anybody wants to
and
talk.
keep it open.
I'm so impressed that you've got 19 people still here. So I'll talk as long as anybody wants to, but
That's
thank you
fine.
very much, guys.
Thank you, Cheryl. Well done.
Thank you.
All right, thanks everybody. So we should connect, Dave, and just catch up.
Yes, I agree.
All right, talk to you later. Bye.
Okay.